Hello, and welcome to a conversation on hydroxyurea. In our work to build and support online rare disease communities like 1SCDvoice.com for sickle cell disease, we're excited to collaborate with members of the community. Today, we are joined by Dr. Buri Anzamariam, a healthcare provider and specialist in the sickle cell, and Shamanika Wiggins, a patient advocate who has been advocating for sickle cell since she was a teenager. Thank you again, Dr. Anzamariam and Shamanika, for joining us today and for all of the work you do for the sickle cell disease community, both as caregivers and supporters. Today, you'll be discussing your experiences with hydroxyurea, both from your perspectives as a doctor and a patient, and specifically addressing how teenagers can and should be a part of those conversations about their health. Thank you both again for joining us.
Thank you so much for having us today.
Yes. Hi, Shamanika. How are you?
Hello, Dr. Bree. I'm doing good.
Great. It's great to see you again, although it's virtually. But nonetheless, it's always so great to learn from you and work with you. Just, people out there, a lot of them know you and your advocacy work, and you've been so amazing at sort of sharing your story. But for those of you that don't know your story, could you tell us a bit about your sickle cell disease story, like when you were diagnosed and what it has been like living with sickle cell disease?
During my college experience, I did tell my friends that I had sickle cell, but it was one of the first times where I wanted to be normal and be like everyone else. So it became easy to forget to take my medicine, which led to not taking it at all and not having a hematologist in my college town. The first 2 years that I was there made it a little more difficult as well. So eventually, as time went on, my sophomore year, I ended up getting really sick and collapsing on campus because of acute chest syndrome. So, it sucks that it got to the point to where I made myself critically ill by not taking the medication. But I think when we aren't educated or informed fully about why we're on a medication, it makes it harder for us to understand the importance of taking it.
I mean, that makes a lot of sense. So it's really sounds to me like it's important at the time that it's being introduced to you, the time that a doctor is introducing hydroxyurea to you, that they discuss why take it, what is it preventing, and maybe reinforcing that in later visits as opposed to sort of a one-time conversation.
Yes.
I think another thing that you mentioned was wanting to feel just like everybody else. And, in the reading that I've done in sort of medicine, there are a lot of illnesses, conditions that people are born with, like sickle cell disease, like cystic fibrosis, like hemophilia, where at that turning point of young adulthood, there is that feeling of like, I don't want to be defined by this disease. I don't want to deal with this disease. So are you kind of saying that in order to make that a reality and feel just like everybody else, one wants to not take medication every day? Is that because it's a reminder, or what is it? What's the connection?
Yes. I think the when you're trying to tell yourself this is my chance to be like everyone else and be normal and not let my illness define me. Because growing up, everyone knew that I was Shamanika with sickle cell. That's kind of how I was described. The tall girl with sickle cell, or the smart girl with sickle cell. Sickle cell was always included. And so college is something new, and it's your time to make your own identity. And you don't want to be known as the girl with sickle cell. So each time you have to take your medication, your daily medication that helps regulate your disease, it's like, I don't want to do this. And college is the first time I recognized depression and mental health, and taking my medication would fuel that, because it's just a constant reminder of no matter what, this illness isn't going away. Like, it's a daily reminder every time you have to take your medication. I'm grateful that over the years my mindset changed and I moved towards being grateful that I have a medication that I can take every day. But, you know, in those younger years before you gain all of this knowledge and awareness, that's how the doctor process was for me.
What kind of supports do you think could have been in place in retrospect? You mentioned not having a provider close to you where you went to college, but aside from that, are there other supports that maybe families out there that have a young adult or teenager with sickle cell disease who's struggling to, stay on their hydroxyurea? Like, what could they do?
I think what could be done is having a good group of friends and being honest with your friends. Because I had a great group of friends, and once they understood the importance of my illness, they would encourage me to do the right thing and be healthy and take my medication. I think it would have also helped if my childhood providers could have helped me find a provider in the town that I was moving to. My childhood providers did tell me of another student on campus that was coming from the program that and we went to camp together. So we met up, but we didn't really click in college. So it's not like we had each other's support. But I think just having the knowledge of the medication, doctors should explain with their labs. That's something my adult doctor did with me. She showed me the difference in my labs on hydroxyurea and off of hydroxyurea and explained the importance of each number and what it meant. And she said, this is proof, scientific medical proof that it's working for you. A lot of patients, especially at that young age, even adults, they don't know how to read their labs. They don't understand the importance of their labs. So I think just having that kind of education shared with us at a younger age would help. And I've met a mom before who has a child with sickle cell, and she said after starting her child on hydroxyurea, she wished that doctors would have told her that hydroxyurea is just as important and just as needed as penicillin, instead of making it sound as if it's an option. So I think, and I'm far removed from pediatrics, so I don't know how they teach the kids about the medication today. But I think just teaching the true importance of it and not just sugarcoating that it'll help you feel better, but tell us exactly how it'll make us feel better. Right. I think people stay on it better.
Right. And I guess, in terms of making people feel better, the clinical trial that led to hydroxyurea being approved by the FDA for individuals with sickle cell disease showed a reduction in pain crises, reduction in episodes of acute chest syndrome, and also reduction in the need for transfusion. And there have been so many follow-up studies since then that have shown lots of the far-reaching benefits of hydroxyurea. So I think most experts and specialists and most individuals with sickle cell disease who've really given it a solid try can attest to some of those benefits. I want to ask you, because you touched on sort of motherhood a little bit tangentially, but I know that you're a mom. Tell us about hydroxyurea and pregnancy and how that was managed, because that's a big question that people have, right?
Yes, it is a big question, and I would like to answer a couple of your questions before hopping into that. You mentioned how the clinical trials prove that hydroxyurea reduces the need of pain crisis, that reduces the amount of times you have acute chest and the need for blood transfusions. And aside from pain crisis, it definitely almost erased acute chest. For me, I haven't had acute chest syndrome in years. I can't remember the last time I had it, specifically. And I haven't had a blood transfusion since 2013. So just experiencing those things proved to me it really is working. Because prior to taking it as directed, I was getting blood transfusions every time I was in the hospital. So it does help, and I like how we say give it an honest try. That's something my doctor had to explain to me as well, that it takes 3 to 6 months for you to really see a difference on the medication. And doctors before her never explained that. So you think, oh, I've been taking it every day for a month and I feel the same. I'm not going to take it anymore. So just understanding how the medication works. But parenting and becoming a mom and having to stop taking the hydroxyurea is hard. I've had a doctor ask me before because I'm getting closer to the age of wanting to have a kid again. And doctor asked me why I even do it, why I even go through the pain and being a mom and having a daughter and going through pregnancy. No, it was very hard. It was painful. I spent a lot of time in the hospital, but it was worth it to become a mother to my daughter. She doesn't have sickle cell, but she does have sickle cell trait. But everything I endured was worth it. But if I would have had like my doctor I have now, who has explained to me, when you should stop taking the medication when you're thinking of conceiving, has acknowledged that it's going to be rough, especially since you are a patient who has responded very well to sickle cell. So acknowledging that and empathizing with that fact, and then working with your doctor to develop a plan of care for while you're pregnant, because things have to change, and making sure that you have your OBGYN as well as your high risk OBGYN. We need all three as women living with sickle cell, because we are special, so we need that extra special care. And my tip and what I suggest women to do, if they're wanting to have kids or are pregnant and can't take the medication, is to just consume as much healthy things as possible, as many green vegetables as possible, as much water as possible, and focus on your why of why you're going through it, deciding to do all of that.
Exactly. So thank you for sharing that. And it sounds like in anticipation of wanting to have another child now, either you have come off of hydroxyurea or you plan to for a specified period of time, and you're working with all of your specialists to guide you in that process. What most women do is they go back on hydroxyurea after they've had the baby and after they've finished breastfeeding, if they plan to do so. Is that something you're planning on doing?
So after I had Rory, she's 9 now, she'll be 10 in February, I stayed off of hydroxyurea for an additional 3 months so I could breastfeed, so that she can get the first breast milk and just start her life on breast milk. So I did it for an additional 3 months with the support of my doctor at the time. And whenever I'm blessed with another kid, I will do the same thing, because that's what's best for the baby. And it's also such a beautiful and powerful bonding moment to be able to breastfeed your child. So yes, I've already stopped taking hydroxyurea, and it hasn't been fun because on hydroxyurea, my hemoglobin is typically at least an 11, which is pretty high for a person with sickle cell. And currently, right now, I'm sitting at an 8, and that's a big difference. So I have to adjust to feeling differently. But again, since I do have a close relationship with my doctor and she is fully on board with this decision, it's making it easier.
Right. I can imagine. Yeah. So just a sort of final question for you. If you had an opportunity to give some words of wisdom to maybe a teenager out there who is contemplating starting hydroxyurea or contemplating stopping it, what would you tell them? What would be your words of wisdom?
So for a teenager that's trying it or starting it, I would suggest them to start it. But I would also suggest them, before starting, ask their doctor every question they want to ask about the drug. It's classed as a chemotherapy drug. So ask all of those questions that might make you nervous or that scare you, or ask about all of the side effects and everything that you may have heard about the medication, because that's a big thing we have to overcome in the sickle cell community. We listen to what other patients have gone through and experienced it and just assume that's what our story will be. So I would suggest them to talk to their doctors, um, ask all of the questions. We were taught as kids there's no such thing as a dumb question. So every question, especially as a patient, you should ask your doctor. I ask my doctor everything. And once you ask all of those questions, I would suggest them to try the medication and to know that it doesn't work overnight and that it takes you, the patient, to put in the effort. It's you who have to do it, not your mom, not your doctor, not the people around you, but you. And just do it with an open and positive mind. Like, just give it, I always tell people, an honest try with an open mind and not be influenced by outsiders' opinions or experiences. And for the teenager who's thinking about stopping it, I would ask them, well, have you took it correctly? Have you been truly taking it every day and you don't feel a difference? Does it make you feel worse? And if they can't answer those questions with the yes, I've been taking it every day, and yes, it makes me feel horrible, I would suggest that they make it a pact with themselves to take it every day for at least 3 to 6 months. And after at that point they don't feel better, then they can stop it, because that's their right as a patient as well. But I feel like everyone, child or adult, should give the medication an honest try for those 3 to 6 months before they give up on it.
Wise advice.
Dr. Bree, I'm so happy that we were able to talk today and have this conversation. But I have a few things that I would just like to ask you as a doctor and to get your expertise on. And one of them is, why do you think, or what do you think the barriers is that is causing hydroxyurea to not be as popular in the sickle cell community or as well accepted as some of us feel like it should be within the sickle cell community and our patient population?
Yeah, so that's so important to address. I think there are many reasons that hydroxyurea has had a bit of a challenging time, really becoming sort of like the bread and butter of what everyone with sickle cell disease takes. You mentioned penicillin, and pretty much every newborn gets started on penicillin with rare exception. And we haven't had that same, I think, penetrance with hydroxyurea. I think part of it is because it was a clinical trial that was run through federal grants, as opposed to being sponsored by a company. And the reason that's relevant is when a company sponsors the development of a new treatment, they also have a whole, group of people whose role it is to educate the public about the new treatment, and they have the resources to do that. And hydroxyurea, having not been initially developed specifically for sickle cell disease and not specifically getting FDA approval through a clinical trial that was run by a company, really had that disadvantage. So it was up to individual specialists, usually sickle cell specialists, to introduce hydroxyurea on sort of a one-on-one basis. And remember, the approval of hydroxyurea in adults was in 1998. I don't even know if most people had a home computer. I don't know that people, were able to stream information about sickle cell disease and hydroxyurea into their homes. Certainly most people did not have smartphones, so the ability to get information out about new treatments that we sort of take for granted now just wasn't possible in 1998 when hydroxyurea was first approved. So I think that was also one reason. And then I think, Shamanika, you touched upon something really important, and that's the fact that hydroxyurea is classified as a chemotherapy drug. And it was originally discovered in, I believe, the 1950s as a medication that could help people who had different forms of leukemia. And, you know, I think a drug that has a label as a chemotherapy is concerning to parents who are making that decision, hopefully with their children, but sometimes for their children, especially if they're young, and also for adults who read the labels. I've had some of my patients come to me after filling their hydroxyurea bottle for the first time, and they're like, wait a minute, doctor, this bottle that I picked up from the pharmacy says I have to wear gloves before, you know, before I take it out of the bottle. They're like, and you want me to put that in my body? You know,
Yeah.
so so, you know, and these are relevant, you know, questions and concerns. And I think some of that sort of detail we don't cover as well as we should when we're talking to individuals living with sickle cell disease about hydroxyurea. I think the other thing is some of the side effects have been, you know, disconcerting to patients. So there's a subset of individuals who take hydroxyurea who may get darkening of their nails or thinning of their hair, and that can be problematic. You know, some people might say, "Oh, well, that's just image, that's aesthetics," but that's important. That's really important, especially I think for teenagers and young adults, right? You know, and so I think that can be a reason why some people discontinue it. And then the other point that I want to underscore that you mentioned is the fact that it's not like a medication that works overnight.
Yeah.
You know, when we give people with diabetes treatments for their blood sugar, or people with high blood pressure treatments for that, we expect that they're going to see improvement very quickly, you know, and we've got a medication that takes a personal investment of several months to make somebody see that it's having a benefit. And I think that can be a hard sell. So those are some of the reasons why I think it can be a challenge. Oh, and of course, the fact that it has to be monitored with blood work. You know, but there are a lot of medications that have to be monitored with blood work. And you know, it is a drain. You know, people don't want to come in and be stuck, but it's important to know that once you get on a stable dose of hydroxyurea, usually those blood draws are really spaced out, usually like every 3 months. And for most people that I treat with hydroxyurea, they say, you know, every 3 months is pretty reasonable. It's just in the beginning, it's every 1 to 2 weeks. And some patients may say, wait, is this going to be how it is the rest of my life? I'm not up for that.
Yeah, I agree with everything you said. Um, like I said, when I started at 16, we did labs every 2 weeks, and that was so annoying to me. But as you mentioned, when patients get on a stable dose that works, it turns into every 3 months, and that's where I'm at now. I get my labs done every 3 months. So thank you for that. And during all of that, you mentioned penicillin, and I've mentioned penicillin. And like, as you said, penicillin is not a choice. Parents are told that your kid has to take this. It's vital to their livelihood. And I mentioned that a mom told me that she wished it was told to her that way. Why isn't hydroxyurea pushed in the same way that penicillin is? Is there a reason why doctors don't make that statement?
Yes, and I think a big part of it is because the clinical trial that showed that penicillin was beneficial to babies born with sickle cell disease was a clinical trial done in children, you know, whereas the hydroxyurea initial clinical trial was done in adults, people 18 years of age or older. And it wasn't until several follow-up studies were done in children and newborns with sickle cell disease that hydroxyurea was then FDA approved specifically for children. So I think early on, physicians, particularly those pediatricians and pediatric hematologists, were faced with doing something that we call prescribing a medication off label. They could prescribe hydroxyurea to children based on their knowledge and expertise. But at the same time, it would have to be done outside of the context of specific FDA approval for children. So I think, Shamanika, that nowadays, since hydroxyurea has been officially recommended by the expert panel report from the NHLBI published in 2014, to introduce and recommend and strongly consider hydroxyurea as early as 9 months of age, I think that has changed the conversation that pediatric hematologists are having with parents of newborns with sickle cell disease. And I would venture to guess that that conversation is less about a choice, although we're always taught we're supposed to, impart choice in our recommendations as doctors. But I think that probably more of the conversations nowadays with those newborns is about how important it is, just as important as penicillin.
Okay, yeah, that makes sense. And if now that I'm older, it makes me happy to know that I was in the clinical trial for hydroxyurea, seeing how it works in kids. I mean, at the time, I didn't understand the importance of clinical trials, and I was annoyed. But I'm happy that my mom made the decision to allow me to be included in that, to help more children and helping even children many years after I'm now an adult. Um, but as a parent with a child with sickle cell, how do they determine, or what should they consider, what should we consider when deciding to put our babies on sickle cell? Like, as a parent, what things should we consider?
What should they consider when thinking about putting or having their child be on hydroxyurea?
Or deciding if their kid is a good candidate, if it's a good choice for their child?
I think that is heavily influenced by the strength of the relationship between the family and the healthcare provider. And I think that the important thing is to have a healthcare provider for your child that you trust. And in so doing, the recommendation of whether or not your child is a quote unquote good candidate for hydroxyurea can be something you can trust, that you can really hang your hat on. Outside of that context, for those people out there who may not have that ideal relationship, I think what's important to know is that the clinical trials that have been done in children with sickle cell disease and hydroxyurea have been very robust. They have shown the benefit in children that we see in adults. They have shown similar side effects that I already mentioned. We didn't see anything new or different in children, and people looked. People were like, okay, well, does this impact growth? No, it doesn't. So there were specific things that were examined in children that was different from when the trials were conducted in adults. And so I think that, if your child is experiencing a lot of vaso-occlusive pain crises or pain episodes, or your child has had the acute chest syndrome, those are pretty straightforward reasons to start hydroxyurea. But I think it's also important for people out there to know that since we've had, I guess at this point, maybe 30 years of experience with hydroxyurea, we also know that there are beneficial effects of hydroxyurea that aren't necessarily felt by the person taking it. And what I mean by that is it looks like it really does preserve organ function over time. And that's not something people think about in childhood, and parents aren't thinking about 20 years from now, 30 years from now, 60 years from now. They're thinking about the here and now. That's what parenthood is about, right? You're trying to do everything you can now to help your child. But I think people need to think about that as well. And that's a big reason why it was, recommended by the expert panel in 2014 to introduce hydroxyurea as young as 9 months of age. It's to prevent potential complications associated with sickle cell disease. So I think parents out there need to keep that in mind. It may still be a good option for your child, even if your child has never had a pain crisis or has never had the acute chest syndrome. And that's where having that conversation with the healthcare provider that you trust is really important to tailor that decision to your family.
Yeah, I think that's a very good point, because growing up with sickle cell, you never know the symptoms you can have until you have it. Um, like acute chest syndrome, we didn't know what that was until I had it the first time. And so that makes a lot of sense to, even if your child isn't struggling now, it's good to start them on it to prevent things that could happen. Because if I could have been on medication that would have prevented me having acute chest syndrome the first time I had it, I would have welcomed it, because acute chest is so painful. And I think it's even more painful when you're a little 12-year-old and it's like, what is this? What is this pain that I'm feeling? But I know throughout our conversation, I've shared things that I wish that my mom would have did and things that parents could do. But as a provider, what are some ways that you would suggest to parents to support their adolescent or young adult in making the decision to take hydroxyurea? And how would you encourage the parents to motivate them? What are some tips you would give?
Yeah, I think empowering them uh, and engaging them in the decision to start, of course, nudging them in the right direction, which most of us parents know how to do. We figure out a way to make our kids sometimes think it's their idea. So use your superpowers as a parent to have the conversation, but have it flow in a way that ultimately the child of it possibly thinks that it's their decision. Um, you know, and also reminding them that starting a medication like hydroxyurea is not necessarily a lifetime commitment. Shamanika, you were really clear on this. Like, give it a solid try. Let's do it for 3, 6, I would say closer to 6, maybe 12 months, and say to your child, we can reassess. But I think the reassessment should be done pretty systematically. And what I mean is, sit down with your child at the time that they're starting hydroxyurea and say, okay, in the last year, let's just write this all down in a journal. How many times have you been in the hospital? How many times have you had to have a transfusion? How many times have you missed school? How many times have you been in the hospital on your birthday or a holiday? How many parties have you missed? Did you miss prom? I mean, all the stories that I hear that are they're highly impactful. Let's write that down today, the day that you start hydroxyurea, when it's fresh in our minds. And then let's open this journal up again, in 3 months, and then 6 months, and then 9 months, and then 12 months. And let's see if there's a difference, because it's always really hard to, I think back that long ago. Write it down along the way, it's proof, the proof is there, and you may not necessarily see a reduction in, let's say, your daily need for either an anti-inflammatory medication or a pain medication, that might be due to like chronic pain, which hydroxyurea is not going to get rid of. But you may see other things. You may see you didn't miss school as much. You were able to go to camp the entire time. You went to all the parties that you were invited to, or most of them. And those are just as important as how many episodes of pain and acute chest syndrome you have. So that would be my sort of practical advice in how to approach, as a family, the start of hydroxyurea.
I think that's a great idea, and I think if it was laid out like that for me, it would have been a more pleasant experience. But I think that's a great idea, because as you said, as kids, missing those milestone events are a big deal, like a really big deal. I spent my 15th birthday in the 15th, I think it was my 15th birthday in the hospital, which isn't fun. No one wants to be in the hospital on a birthday. I spent 2 Christmases in the hospital as a kid, and I missed a lot of stuff. So I think those are great ways to look at how this and track how the medicine is improving. And I think that it's a great tool for parents to have. I wanted to touch on something before we move on to the next thing. It definitely doesn't affect growth. I'm almost 6 feet tall, and I started hydroxyurea in the middle of my growth spurt. So that was something that it definitely didn't affect me, and it's never ever did anything to my hair. But I did get the dark bands, but that didn't bother me because I typically keep my nails painted or done. But when you were saying it didn't affect growth, it made me laugh because my pediatric doctors would always ask my mom, "What are y'all feeding her? She's taller every time you bring her back." At one point, I was the tallest girl in clinic, so it didn't affect my growth. But I think what you laid out for parents is great. But what advice would you give to a teen patient, or what resources or guidance would you give to a teen patient who's making this decision to start hydroxyurea?
I think I would talk about what are their goals. What are their goals in life? Where do you see yourself in 2 years, 5 years? 10 years is tough, but where do you want to be? And what is it you're going to do to make yourself as healthy as possible so that you can do all the work that's necessary to achieve those goals, to realize those goals, to finish school, I hear all kinds of things. I want to finish school. I want to go to graduate school. I want to start a family and get married. I want to own a house. I want to have a car. I want to move out of my parents' house. I mean, there are all kinds of like goals that people have, and say, okay, these are fantastic goals. Let's write them down. Now, what are you doing today to ensure or maximize the chances that you are going to be healthy enough to realize those goals? Because ultimately, that's what's most important, right? You want to enjoy life. We get one shot at it. So that's what I would say.
And are there any resources that you would point them in the direction to or provide for them, or any that you know of?
Yeah, so there are resources on hydroxyurea. For example, the Sickle Cell Disease Association has resources on hydroxyurea. The American Society of Hematology has some resources on hydroxyurea. Your community-based organizations, there are so many community-based organizations that advocate for sickle cell disease all across the United States. I would contact your local community-based organization and see what resources they have. Some people have community health workers that can help reinforce with your child and teenager the importance of hydroxyurea. There can be sometimes peer mentors. You touched on this, Shamanika, how important it is to have your peers support you. So those are some of the resources I would point people into the direction of. And of course, there's the One SCD Voice platform, which has a lot of curated resources on hydroxyurea that you could take a look at.
Thank you, Dr. Bree. Those are all great options, and I wish that I had some of those options available when I was a teen, because as I said, I was provided a clip from a medical journal. But thank you so much for that guidance and that insight, because I'm pretty sure it would be very helpful and useful, especially since I have teens in my family with sickle cell. I'm no longer the only one in my family. So thank you.
You're welcome. It's always a pleasure to work with you, see you. I learn from you every time. So thank you, Shamanika. I think we both want to thank everybody out there who's watching this, and hope that the knowledge that we've imparted today can help you in your home be successful with hydroxyurea, and that you've begun to understand maybe a little bit more about why it's important and what it does and what it doesn't do. So, we're extremely grateful and glad that you tuned in today.
Yes, thank you so much, everyone.